this episode of the ACSELL Cast, we are speaking with Rebeka Žerovnik, project manager at Technology Park Ljubljana, to talk about her region's good practice, HealthDay.si. We cover how the good practice came to be and what your region can learn from the work they have done. Here's the episode. So, Rebeka, great to have you with us today. Just to start with you, maybe I could ask you to introduce yourself real quick to us. So, what are you doing at Technology Park, and who are you?
Hi, thank you for the invitation to join you here. My name is Rebeka, and I joined the Technology Park of Ljubljana last year. Actually, I'm one of the newest members, but I know HealthDay from my days when I worked where I worked before. I was part of different startups who were joining the HealthDay community as part of the businesses who are just stepping into the healthcare sector. I was actually one of those who needed help from HealthDay and the Technology Park to really start building their own impact in the healthcare sector. Yeah, and then after some years, I actually realized I really want to work in this field, but not in the industry part, but actually more on the policy and business support department. So that's why I joined Technology Park, and I recently also took over the health department. So I'm pretty new in this field in one way, but very, really passionate about.
Excellent, and good for us. So lucky us, we were able to get to know you and work together with you within the Excel project. So yeah, great to have you on board, and great to have you with us today. After we learn a little bit about you and Technology Park, maybe we can now tackle a little bit the good practices. So we would like to talk about good practices today in this episode, and maybe we can start with kind of the context when and how this good practice evolved, more or less. So what's the problem you were trying to solve when you came up with that good practice?
So I wasn't part of the start because
Yeah,
that was
okay.
already in 2014, but I know the story, so I can still share it further. It all started from the pain of startups actually, who were starting to enter the field of healthcare. So yeah, the startups who wanted to enter and help the healthcare system, but didn't know who to contact, where to start, what are all the barriers that they are in front of them. They really didn't know in what kind of a difficult situation they are sending themselves. Actually, the businesses started to build a community. They start the HealthDay.si community, which was supposed to connect the industry and the healthcare sector to help them build a dialogue, to help accelerate the digitization of healthcare in Slovenia, and to really open up the dialogue to help them. There are several communities like connecting the healthcare professionals with each other, and you have businesses connected with each other, but you don't have both professionals and the businesses connected with each other. So here was HealthDay could actually step in as a neutral point for all to get together to start pinpointing their problems, their expertise, and their also connect better with the foreign best practices. So looking for what is happening across the border in Italy and Austria, and as well in Scandinavia, in the UK, and so on, and to help to push the digitization further. So yeah, HealthDay was initiated by the companies Better, Messi, and XLab, together with Technology Park of Ljubljana. Mm, but it really, but from the start on, it started to connect with the professionals, and in the last years, we've really pushed forward also with on the part of patients. So patient organizations, the healthcare policy makers. So we are trying to connect all four quadruple helix now. So the family expanded very much.
Very good. Yeah, and we all learned that the quadruple helix is the way the way to be, or how it should work, right? But that's on the one hand, that's the norm, so the idealistic perception of that maybe. But on the other hand, we all know how difficult it is to really encompass all the variety, various actors and players into those networks and ecosystems. So when I get it right, you support by more or less coordinating the network, bringing people together, giving advice. Yeah, more or less the orchestration or the coordination, right, of this network.
Yeah, exactly. It started first with just one conference per year. It was one big HealthDay conference, which started to bring them all at one place in Ljubljana to meet up, to push forward the dialogue. And it expanded then to several events through the year with different workshops. We collected the topics that are interesting for most of the stakeholders, and we organize them through the whole year. And in the 2019 we actually then developed the DIH, Digital Innovation Hub, Hell Day, who was more focused on the support for startups. So we developed a special program with workshops and individual mentoring for them, focusing on medical device regulation, on how to promote, how to build marketing in healthcare sector, how to start the dialogue with the healthcare professionals who are usually your users, so users of the new technologies, innovations, and so on. It was very specific, but also there was nothing similar to it in our area. You have several accelerators and programs like this across the globe and Europe, but there was nothing until we started building it. We evolved out of one event yearly now to several events per year, and a communication platform that's always posting about the events, good practices, what's actually happening in our field, so in Slovenia. But also we were always open to foreign collaboration, so it's not just focusing on the healthcare in Slovenia, but we are trying to look for good stories from across the from abroad, and then bringing it here, so our local stakeholders can learn from it.
So I mean, you've got an impressive track record, more or less. I mean, 8 years of existence already. Maybe just to show to our listeners what they can learn, or what is key. What do you need? So talking about resources, what is your experience? What do you need to set up something special like the Health Day SI? So what do you need? What kind of resources are really key and needed?
Definitely people with passion, those who really want to make changes in the world. And that's also the main, I would say, the main reason why Hell Day existed for so many years, because there were people who started it. They were passionate about really making some changes here in the local scene. And because it was not supported by any governmental money, or there was no business model behind it. So it was really depending on the people who were involved. But we could actually, from the good experience, from the impact that we already did in those years, we did then manage to get funding from the Slovene Enterprise Fund, to build up the startup program, the accelerator program for startups. And we managed to get some funding yet to run it each year now. And we hope we can then involve it further on. At this moment we are also we need to find more manpower to really expand the work, so to manage greater impact, but we don't have like an exact number because it really depends on the people involved what we could actually do. Luckily, yeah, for the start, so for the business support, we actually already got funding, which is around 40K per year. Yeah.
So a lot of passion and some money is needed.
Yeah,
Yeah.
yeah,
Okay.
exactly. But then, of course, if we really want to do huge differences,
Yeah.
we would need more. But that really depends on each project separately. So we are applying to European projects to get that funding.
Okay, okay, and yeah, you were talking about impact. So I know this the policy network platform of Interreg Europe. They have all those indicators measuring success of good practices, etc. So how is your experience with success or impact? So how would you say or measure that HealthDay.si is successful? What are you looking at? So how would you um, try to measure what is your evidence that the good practice was a success?
Yeah, firstly, we were measuring the number of people joining us, coming to the events, participating, yeah, at the events, and how many partnerships came out of these meetings. Unfortunately, I don't have exact numbers because we were really not good at measuring until now. But we are now building actually a impact measurement system because it's really important for us to know what are the exact numbers of our work to help us more easily prepare new KPIs for the next year. So, but we did until now made it happen for five innovations were successfully introduced to the medical registry, to the register of medical devices. So that was a KPI we decided on in 2019 and finished by the end of 2020. We had already 3 generations of 5 startups per year, and we are expanding the number of stakeholders, so people are enthusiastic about what HealthDay is working on each year, and we are currently around 1,500 people already
Wow.
connected in this scene, and these are individuals who just want to know what's happening on the medical field, or medical doctors, so medical professionals, policymakers as well, and of course a lot of stakeholders from the industry. These are CEOs in one field, but also workers dedicated for cybersecurity, or also innovating in medical innovations, programmers. It really the we don't have a typical persona, if you say it like that. It's those are. We also expanded to the field of biotech last year. We tried to connect businesses and academia from the biotech sector, because it's also quite connected to the medical field, especially here in Slovenia, when most of the biotech companies are pharma related and so on.
Hmm. So congratulations. That sounds successful and pretty impressive. But yeah, I mean, in 8 years of practice, maybe in the past there have been some difficulties, and maybe we can talk about them as well. So what were the difficulties you had with a good practice? Maybe not in the beginning, I don't know, or in the beginning, or over the course of the network. Have there been any difficulties?
Of course, there are
Yeah.
always difficulties. Yeah, especially if you have so many people at one place. And it's always so. Especially Technology Park of Ljubljana was. We are a neutral player in this field. Like we don't have one of our own product that we want to sell, that we want to build up. So they're really like Switzerland in the whole community, and can then really help along the dialogue between academia and businesses, and business and healthcare. So medical professionals. because there are always some misinterpreted communication. So there, we we are still having difficulties to communicate. I mean, not just in the health, not just in the community, but everywhere. So we have to be to care for them, yeah, to help if there are any miscommunications, if someone misunderstood some other's work. And there were yeah, a few years ago we had a startup who was very enthusiastic about introducing their own invention to the patients, but was really bad at communicating, and which came out as a the patients misunderstood what they were doing. They were just testing a new innovation, and unfortunately the patients started to panic because they didn't understand the results. They thought something is wrong with them. So we really had to jump in to help to clear the ground, that nothing that it was just a testing phase with no real diagnose. Yeah, there was no bad diagnose, but because they didn't understand exactly what was written on the paper, they already had a panic attack actually.
Yeah, well, that's an important learning. Yeah, yeah.
It
No,
was a
absolutely.
really important learning.
Yeah, yeah. No, and talking about learnings, I mean, are there any other learnings you could provide to our listeners? So, what can other organizations or regions can learn from your good practice? Do you have any advice to us?
I would say it's really important to once you structurize a community or so, yeah, an association. Um, well, that's actually the main problem right now from HealthDay, because it was a community with no legal paper. Where we didn't had a real definition of what it is. It's just a community, and it didn't had. It was not a business with a security number and so on, but just people gathering together. And once you start to apply for EU projects, once you really want to build something, you have to have a structure, a real structure, either under one organization or a separate one with several organizations being part of it, like being owners of it. Yeah. So this is one of the things we are actually building right now. How they will probably in a year become a separate unit with an official place of
Yeah, so a legal entity in order to be
exactly. Yeah, yeah,
okay, in order to be able
yeah,
to apply for funds and to participate
exactly.
as an organization.
Because as I said, we were four businesses starting it. So there are four partners who are having their own in it. And yeah, until now it was somehow facilitated by the Technology Park, but will eventually become its own entity, because it will be much easier to organize, especially once we really want to make some not just local projects, but yeah, international projects.
No, that's another important learning, I guess, that you need structure. I mean, with all the passion, with all the people, with all the creativity going on at the very end, yeah, to some extent, you need structure and organization.
Exactly. Yeah,
Yeah,
yeah.
it's a give and take. Yeah, that's important, I guess. Um,
We didn't fix it yet. It's in the making of, like, we have 1 year. We now choose to have 1 year to
mhm.
figure out how we're gonna do it,
Okay,
what's
yeah.
gonna be the
So
best
you
way.
set a date. Yeah,
Yeah, we
deadline.
set a date.
Okay, good.
Yeah, exactly.
Yeah, that seems to be really structured. Very good. Again, congrats. When we talk about structure and creativity and innovation, maybe at the very end we can talk a little bit about openness. And yeah, during the Excel project, we face a lot of, or we talk a lot about innovation, and we talk a lot about SMEs and small and large organizations that try to innovate, and how we can involve SMEs into all kind of innovation activities. And what we've learned is that at least to some of our SMEs, open innovation could be a key for success. But on the other hand, we often see that it is not so easy to tackle them, to reach out to them, to get them involved, to convince them sometimes that it could be worth efforts, etc. So maybe you can share with us some of your experiences and reflections about this openness and how easy it is for organizations in Slovenia to be open for open innovation.
Yeah, during our research, we realized that younger companies, so yeah, especially startups or some those who are already a bit older startups, a few years older, are very very open to it. They understand the benefits of the open innovation, and they also probably it started also from the lack of funding. They knew they had to get the medical sector to start collaborating with them from the beginning on, to not putting too much money in the innovation that's not suitable for the market. While on the other hand, we realize that the corporations are still doing it the other way. they are they are financing a lot of innovations without collaborating with the targets. And then once they already entered the market and they realize it's not working, it's not being used, they start to think about testing it with the first users and start to collaborate. But even then, they are not really open, they are not really collaborating, they just want to prove that they are doing it right, with the mind. I'm still doing it okay. I just need to prove, to have a paper at the end of the a testing phase, that I did it correctly. They are not really open to a negative, so to a critic, yeah, to a critic actually. While on the other hand, the young companies are, so yeah, maybe I have to point it out that Slovenia is really really small, which means it's very easy to access a doctor, a nurse, or so on. You were It's either you that already know someone, or your parents or your neighbor knows someone. So it's quite easy to get access here, in our country, to the target community. So you can it's easier to get like an initial confirmation already in the idea stage, and then start working on it. So we actually have several startups who have medical specialists already in the founding partners. Yeah, being part of the from the start on. So it's I, I was kind of surprised and very happy to see that. And now I'm actually trying to explain it and promote the open innovation with the older companies, so with more rigid organizations as well. Um, it depends on the who are you talking to. Sometimes it's they're again a bit more flexible and they already start to nod and understand, but I think there's still a lot of work to do for us. Um,
Yeah, but probably, I mean, the rich amount of your SMEs and startups that you involve in the activities of Technology Park Ljubljana and probably of HealthDay.si should help you as serving as testimonials that that it can make a difference, right?
Exactly. It's again one problem that we don't, neither we or the startups are building a metric system. So we don't have exact numbers to show the other companies to support our thinking. So the it's better once you have some yeah, numbers who could support what are the benefits of this kind of cooperation. And it's on us now to really gather these numbers to help them adapt to to open innovation in the next years. And it also helps us to learn about the best practices from other ACSELL projects, ACSELL partners, because it doesn't really matter always to show them the practice here, but it also helps me to connect with the practices abroad and bring them then to visualize the benefits, to really give them something to hold on. And it's much easier to make the next step afterwards.
Hmm. Right. Excel accelerates. Great. Okay. Yeah, it was a pleasure talking to you, Rebeka. Thank you so much for joining us for today's episode. And thank you, our listeners, for joining us as well.
Thank you, Daniel. It was great to be part of it.
Be sure to check the show notes to see where you can find more information about HealthDay.si, Rebeka, and the Ljubljana Technology Park, Interact Europe, of course, and our lovely ACSELL project. ACSELL Cast is created by myself, Daniel Boer, as well as Sandra Evans and Christine Hopkins. Talk to you soon.